What is the reason for the scarcity of Adderall, Ozempic, and other medications? The United States is witnessing a surge in drug shortages, including Adderall. Unfortunately, experts are uncertain about how to alleviate the issue. This predicament could lead to prescription-related hindrances, including treatment delays and medication changes for patients. Shortages of vital medications have caused great concern among patients, parents, and physicians due to recent unforeseen demand surges, production issues, and limited access to ingredients. The deficit of drugs treating ADHD, like stimulants, has been particularly challenging, with multiple factors contributing to the crisis and no clear end in sight. The problem of drug shortages, especially concerning generic drugs, has persisted for a while. Due to industry consolidation, some manufacturers lack sufficient motivation to address this because the low margins generated by these affordable generics hardly translate to ample profits. Let's delve further into the matter. The University of Utah Drug Information Service reports that this year's first quarter saw a total of 301 active national drug shortages. This number marks a significant increase of 49% from the 202 recorded during the same period in 2018. According to Stephen Schondelmeyer, a professor at the University of Minnesota College of Pharmacy, patients may not always experience the full impact of drug shortages. This can be due to doctors substituting different medications or other parts of the drug supply system masking the issue. According to him, the scarcities are increasingly conspicuous and frequent now. What medications are currently experiencing a shortage? Autumn saw the U.S. Food and Drug Administration declare a deficit in Adderall, the medication used to treat attention deficit hyperactivity disorder due to manufacturing issues. Unfortunately, this problem has continued to expand and now encompasses other stimulants used to manage the condition as well. According to Erin Fox, a researcher at University of Utah Health, the situation appears to be getting better. Despite this, there seems to be a dearth of many extended-release doses of the medication, which is its most commonly used form. The FDA has reported a deficit in Ozempic, a medication used both for diabetes treatment and weight loss, with a surge in prescriptions since mid-2021. IQVIA, a health data firm, has recorded a twofold increase in prescriptions for Ozempic, surpassing 1.2 million, and the drug is being promoted by celebrities and others on social media. According to a representative from Novo Nordisk, the creator of Ozempic, the medication is presently accessible at pharmacies across the country in all doses. In recent times, a surge in respiratory ailments led to a temporary curtailment of fever-reducing drugs for kids by drugstore chains. Additionally, there was a scarcity of the antibiotic, amoxicillin, during the same period. Senator Gary Peters, D. Michigan, who chairs the Senate Committee on Homeland Security and Governmental Affairs, reports that injectable drugs administered in hospitals and clinics, including cancer treatments and IV saline, are at a higher risk of shortages as compared to tablets or topical treatments. The likelihood of shortages in these injectables is more than double. The reasons for shortages can be manifold, and often a combination of factors contribute to them. As the number of individuals using the drug increased, the Adderall production issue emerged. Amid the pandemic, regulations were relaxed to permit doctors to prescribe medication without physical consultations. As a result, prescription rates for Adderall and its generics surged by 20% from February 2020 to the end of the year, as per IQVIA data. Meeting the surge in demand for Adderall becomes all the more difficult due to the drug's status as a controlled substance, leading to limited supplies each year, as imposed by federal regulators. The cost of medication may also play a role in determining its viability. As a medication for diabetes, Ozempic is widely recognized. However, the very same drug, semaglutide, is also marketed under the brand name Wegovy for weight loss purposes. While discussing the difference between these two drugs, Schondelmeyer pointed out that the price of Wegovy per milligram can be more than twice the price of Ozempic. According to Schondelmeyer, there has been a surge in sales of Ozempic due to the reluctance of people to spend a lot of money on Wegovy. According to an Alison Schneider, a Novo Nordisk representative, the dearth in supply cannot be attributed to pricing. Instead, the shortfall is due to a combination of factors, such as a surge in demand and global supply constraints. According to Fox, a contributing factor to the lack of availability of medications like amoxicillin and Adderall is their low profitability, which disincentivizes pharmaceutical companies from producing and stockpiling large quantities in anticipation of potential shortages. It's incredibly difficult to fix a shortage of something that is produced on a just-in-time basis, unless all suppliers are operational again, she explained. Inadequate supplies could potentially result in postponement of treatments, significantly impacting those with time-critical illnesses such as cancer. When healthcare professionals are compelled to prescribe alternate medications, it may result in suboptimal outcomes. Additionally, if the doctor is unfamiliar with the substitute medication, it could lead to medication errors. In addition, patients may face the inconvenience of depleted prescriptions or the need to scour for a pharmacy with ample stock to renew them. Anticipating when numerous scarcities may be resolved is challenging, particularly due to difficulties in gauging demand. Estimating a 10% increase in production is insufficient, remarked Mike Gagno, the Senior Director of Pharmacy Practice and Quality at the American Society of Health System Pharmacists. But will it suffice? Despite current stability, the potential for future scarcity remains. The Senate report emphasized apprehension over the continued dependence on foreign sources. The bulk of unprocessed substances that constitute American drugs are sourced from factories based in India and China. Due to the COVID-19 outbreak, India, in an effort to safeguard its own pharmaceutical supply, enforced a ban on exports of 13 active pharmaceutical ingredients and their derived medications. Shortages of essential medicines can persist for many years, making it difficult for patients to obtain accurate information about them. According to Fox, drug manufacturers are not legally obligated to keep the public informed, exacerbating the problem. According to the Senate report, there is no single federal agency or private industry partner who has complete visibility into the complete pharmaceutical supply chain in the United States. According to Fox, the shortage of stimulants has been a source of great frustration. Manufacturing companies have reported insufficient raw materials as the reason behind the shortage. However, the federal government claims that the companies are not utilizing what they already possess. Fox stated that there has been a great deal of mutual blame being cast. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.